Good morning, everyone. Welcome and welcome to the Hindu editorial reading and summary series presenting by Diction Addiction. Uh, Yesterday, I've shared the why do I have to start a channel, right? So I got good response for that, and I'm trying to tell you, do I have credentials to own a YouTube channel or not? You must be wondering, I must be wondering sometime why I should have do I have a credentials or a qualification to start or own a YouTube channel? That's my question. I want to answer that question. Anybody who wants to learn, they can own a channel, because when a person is learning for himself, he will learn with the 100% commitment, right? So once you start learning, then say, that is a selfish motive to learn, in my view. But once you learn, then if you share with your surroundings, with your friends, or people in the other side of the country or same country, right? So then you can share. That's a selfless. So those who wants to learn and share can have a YouTube channel. This is my answer, as I do have credential, right? But one thing is very important here. Any journey you start, two things play important role to be a successful or to continue journey. I don't say success is a journey. So be one must go on, right? For that, two things I feel very important. One is consistency and commitment. Consistency means what you have to do irrespective of the mood and time and environment. You have to perform consistently. You have to do it. There is no break. And commitment, whatever commitment you have shown on first day, and the same commitment you have to show on and reflect on the last day also. So that is what is commitment. So if at all you have consistency and commitment, and you can start anything in the world, you can take up any journey in the world, nothing will stop you. Okay, that's fine. Do you have a, besides my, I just want to share my education credentials, which are help me to secure a government job. That's I'm an assistant professor in the Department of Applied Bioscience, Mahatma Gandhi University, Nalgonda. So if you look into my academic qualification, I did my BSc, Bachelor of Science in Microbiology, then Master of Science in Biotechnology, and a PhD in Biochemistry. So I guess I have covered microbiology, biotechnology, and biochemistry, all modern life sciences. Then also I did a postdoctoral fellow on biofuels, how to use the wood or say logs to convert it to the fuel. That's what my postdoc. Right now, I'm an assistant professor. I'm teaching to the biotechnology and biochemistry students in the Department of Applied Bioscience, Mahatma Gandhi University, Nalgonda. This is what about my introduction. And also, I want before going to the today's topic. Under pictorial primer, as usual, we'll see the relevant pictures, which may play important role in understanding of the today's article. You see, today's title is England in Lockdown. England in Lockdown. on rapid spread of COVID-19 variant, right? You see this picture, COVID-19 cases very high in London, stay at home. This reflects the condition of England and London, right? You must be worrying about what is variant and variant. Variant is a small change which has happened in the earlier strain reported. So this, why there is a mutation, why there is a change in the COVID-19? Because COVID-19 is a RNA virus. RNA viruses are undergo constantly changes. Some changes are good for the virus, some changes are bad for virus, bad for virus. Means they won't replicate. When the virus is, the very changes which are helping the virus to spread quickly, that's a bad news for humans. That's what is happening right now. So variant is a small change in the genome of COVID-19 virus that's accelerating the transmissibility. Why it is increasing speed? Because people are not sitting together, they are maintaining the physical distance and using a hand sanitizer and so on, right? So obviously virus is also choosing a different path to enter into the humans. So this is what is a funny way of telling, but this is a more high, it is having high transmissibility. Let us look into the facts of, let us look into the data of UK. See, UK has reported 2.7 million cases, right? In 27 lakhs cases and 75,500 deaths as of now. As of now, it is second highest in the Europe. Second highest in the Europe. And people are talking about the transmissibility and transmissibility. It is, they say it is highly transmissible. What it means how many persons are getting infected with the one person is considered as transmissible. When a person is able to spread the virus from 1.5 to 1.7, this range is called as highly transmissible. If it is under 1 and it is controllable, it can be controlled, but it is 1.5 to 1.7. Almost each person can infect almost close to the 1.5 to 1.7, means 2 people. That's a highly transmissible. And you see here, the new variant appears to affect the greater proportion of individuals under 20 years. This is, it's not, you see, why it is happening? Because from the September to the December, when the data is analyzed between that time, they check that why it is happening. The college goers, college students, university schools and college students are, they opened the educational institutions. So students are tend to attend the classes. So that's why it is now it is appears to be greater proportion of individual 120. So it is infecting the students age of 20 years or below 20 years. Right? Yes or no? Yeah. I want to highlight the lockdown. Boris Johnson, Prime Minister of England or Britain, is supposed to be the chief guest of Republic Day. He's supposed to come to the India, but he cancelled the. You see, Boris Johnson cancels the Republic Day visit to India over COVID-19 crisis in UK. You try to understand the severity of the situation in United Kingdom. So it's President Boris Johnson cancelled the Indian trip. Why is? Because he wants to monitor the situation on minute to minute basis. He wants to see how things are going on. So that's what he is cancelled his Indian trip. So this, cancellation of trip will tell you the severity of the COVID-19 in the UK. So be aware of this one. Then coming to the loudspeaker, oh no, sorry. I added one new feature for the today's video. That's a general knowledge, GK questions. Whoever is preparing for competitive exams or any other competitive exams. So what is a possible question from the today's article? That's what I thought. So, name the new variant of COVID-19 found in England and what is its reproduction rate? This is what I thought. Whoever is writing the competitive exams, probably this question may come in that exams. So here is the answer. VOC 2020 12 and 01. 12 means what? 2020 VOC variant, right? Variant of COVID, variant, I'm guessing, variant of COVID, 2020 year, and this is the month, this could be the date of identification, right? So this is what is a new variant found in the England. And what is its transmissibility or reproduction rate? 1.5 to 1.7. This is what highly transmissible or reproduction rate. Yep, let us go to the loudspeaker where we read the article with loudspeaker. Why we have to read loudly? Because you understand and assimilate and the article very clearly, and also you will be hearing your sweet voice, right? Yep. In a bid to control the spread of highly transmissible new COVID-19 variant, that is VOC 2020-12 by 1, the UK announced on Monday a fresh lockdown in London and Southeast England, which is expected to be in force till mid-February. The decision comes after much dithering. The scientific advisory panel had recommended days before Christmas that the government consider a national lockdown, including shutting down educational institutions. As on January 4th, the UK has reported 2.7 million cases and over 75,500 deaths, the second highest toll in Europe. More than 50,000 new cases have been reported daily since December 29th, 2020, with a peak of nearly 59,000 cases on January 4th and over 4,400 deaths daily. On Monday, more than 26,000 COVID-19 patients were admitted in hospitals, an increase of 30% from the previous week. Though new variant does not cause increased disease severity or mortality, a surge in cases and hospitalization can lead to more deaths. It is more transmissible. The reason why the reproduction number is 1.5 to 1.7. The speed is considered to be under control when the reproduction number is less than 1. Based on an analysis of cases and genome sequence of nearly 44,500 samples collected from England between September 21st and December 13th, it was found that even during the previous lockdown, the new variant spread in many locations. This even as fresh cases were generally dropping due to the reduced spread of the dominant strain. There is evidence that earlier lockdown was effective in containing the previously predominant strain, suggesting that a new variant grew in absolute terms. The rapid spread of the new variant even during the previous lockdown might not reflect the general failure of control measures but highlights the inherent nature of the new variant to rapidly spread given its higher transmissibility. That areas with the slower baseline virus spread also reported a slightly reduced spread of the new variant suggests that it is indeed possible to reduce, if not suppress, the transmission of the new variant if the lockdown is stricter and compliance is better. It is for this reason that, unlike in previous lockdown, schools and universities too are to be closed now. The great, no, sorry, the new variant appears to affect a greater proportion of individuals under 20 years. The selective spread among the young might probably be more because educational institutions were open during the previous lockdown than due to the inherent nature of the virus. Since a resurgence of new variant is likely when the lockdown is lifted, the focus is on accelerating vaccine rollout so that much of the population is protected and transmission is cut. The spread of new variants should alert other countries, particularly South Africa, where problematic mutation has been found, to remain vigilant. This is what under the loudspeaker you might have observed few words only I have highlighted today. It means that most of the words are very easy. So those few words, highlighted words, will be explained in the next video under vocabulary. And now we will move to the nutshell. If you look into the article summary, it says that new variant does not increase the mortality. No mortality rate is same as with the previous virus. But the only thing is that there is a 30% more hospitalization. It's more people are going to the hospital. So what will happen? What will happen? The number of beds which are occupied in there won't be many vacant beds for emergency use, right? And your health workers are fully exhausted, right? So in a way that you are giving more work to the health workers, and that leads to the exhaust of their work. They will have more workload to perform, and obviously it will affect the health system in Britain and or England. So for this, when many people are coming to the hospital, then also there is a chance to transmission of the virus quickly. They will interact, attendances, other would be interacting with the people. So there will be a chance to increase the risk of spreading the virus like a wildfire. And you see, this virus is not new to the England or Britain. Why? Because when they did the genome analysis, genome means they isolate the virus from the patient, and they'll sequence the RNA, and they say whether it is what is the prevalence of this one new variant from what time. So when they did it, it was there since September, means 3 months. Since 3 months, it is very much sitting in the England, because number of cases were increased right now. That's what we are worried. But otherwise, it was there since September, almost 3 months, from now, right? And how to control it, that's the most important one. The best way and proved way is that strict lockdown. Strict lockdown is the only solution. And second thing is that anyway they have started the vaccination to their people. So if they can include the as many as possible, so they can cut down the infection as well as they also cut down the transmissibility. This is what they can do. This is what they can do at this moment. And this time, lockdown is included the all educational institutions. Previous lockdown, they opened and opened the education institution. Now they completely closed. Everything is closed, shut down, complete shutdown. Why? Because the variant is spreading among the 20 under 20. It does not have any affinity with the under 20, but only thing is that these are the people who are roaming in the public space very commonly. That's why they are affected. Otherwise, they don't have any, the virus, new variant do not have any affinity with the under 20. So it is a time for the strict lockdown only and vaccination as many as, so that the transmission of virus as well as infection would be controlled. And what about India and other countries who have operated the flights? So I think we have India or other countries who have operated the flights from that country have received their proportion of virus. So it is now the country's responsibility to take care of the virus, new variant. We don't know whether it's going to be wildfire or comparable with other strain. So geographic conditions of the India or other countries are different from the England. So we don't know. We have to wait and watch. That's it. So better. This is what I can tell about the today's article. And if at all you have any questions, you please do comment in comment box. If at all you like it, just you press like button. If you want to subscribe, you please do subscribe, man. Right? Have a good day.